So today's topic is Abernethy Malformation. So what is Abernethy Malformation? It's a congenital extrahepatic portosystemic shunt. In Abernethy Malformation, blood is shunted into systemic circulation either partially or completely via abnormal communication. The classification of Abernethy malformation is based on anastomosis of portal vein with inferior vena cava. Abernethy malformation is of two types, type 1 and type 2. Type 1 is complete Abernethy malformation in which you will not find portal vein and portal vein radicals, while as type 2 is incomplete Abernethy malformation where you can see portal vein as well as portal venous radicals. Type 1 is further divided into two types, 1A and 1B. In 1A, splenic vein and superior mesenteric vein, they separately drain into IVC, that is inferior vena cava. While as in type 1B, splenic vein and superior mesenteric vein, they form a common vein and then drain into inferior vena cava. Now coming to type 2. Type 2 is incomplete Abernethy malformation. That means you can find portal vein, you can find portal venous radicals, and in addition to these, you will find an abnormal communication between portal vein and inferior vena cava. So, what are the differences between type 1 and type 2 portosystemic shunts? Type 1 is more common in females, while as type 2 is equally prevalent in males and females. In type 1, portal vein and portal venous radicals will be absent, while as in type 2, portal venous supply is partially conserved. In type 1, concomitant congenital anomalies may be present, while as in type 2, you will find very few concomitant congenital anomalies. Type 1 presents in young, while as type 2 presents later. In type 1, the type of anastomosis is end-to-site, while as in type 2, the type of anastomosis is side-to-site. Now, coming to the clinical features of Abernethy malformation. The clinical features in Abernethy malformation are either due to shunt or secondary to hepatic lesions or the symptoms associated with associated congenital anomalies. Now, what are the clinical features that are related to the shunt? Since portal blood directly goes to systemic circulation, therefore, In Abernethy Malformation, you can find portopulmonary hypertension and hepatopulmonary syndrome. You can also find metabolic dysfunction. You can find hyperammonemia, hypergalactosemia, hepatic encephalopathy, and portal hypertension. The clinical features can also be due to hepatic lesions like nodular regenerative hyperplasia, focal nodular hyperplasia, adenoma, hepatoblastoma. And there are symptoms related to associated congenital anomalies like cardiac, VSD, ASD, AS, PS. We have genitourinary, we have splenic, we have skeletal, we have arterial or venous anomalies. Now coming to the management of Abernethy malformation. The management of Abernethy malformation is shunt closure, either by radiological intervention or surgery. What you need to monitor in Abernethy malformation, you need to do ultrasound abdomen every 6 monthly to rule out nodular lesions. You need to do annual SaO2 and ammonia screening.